The 8-minute rule talks about this. So, when the physician spends a therapeutic activity with a patient for like 8 to 12 minutes, that can be reported as 1 unit, and up to 37 minutes it's like 2 units, up to 52 units it's like 52 minutes it's like 3 units, up to 67 minutes it's like 4 units. What is the need for these timed activities? So when a rehabilitative session is being done, or when a session is being taken care by the OT or the PT or the athletic trainer, we need to know what are all the activities that are being done. You have to divide it into supervised and the ones that require constant attendance. Supervised modalities do not require the time documentation. Okay, just the mere documentation of such activity is sufficient for reporting the supervised modalities, whereas for timed modalities, time should be documented. Okay, and here this rule is called as a 8-minute rule. This is what the CMS follows. Now what happens is, so Medicare follows this 8-minute rule. There is another way of working around this 8-minute rule. It's like the CPT way of calculating it, because the CPT, as we all know, for example, if you take the massage, which is CPT 97124, here you need at least half the midway point of the time should elapse. Say for example, the CPT reporting of time-based service is nothing but, if the service is going to be like 30 minutes, here it should cross at least 15 minutes. So the midpoint needs to be crossed. So at least from 16 minutes we can report that code. CPT way of reporting is that you will have to know what is the total time the activity has been performed, and if half the time has elapsed, then you can report it. Whereas Medicare guidelines or the CMS guidelines, what you would have to do is like, you will have to calculate the total timed session. Okay, you will have to figure out the total timed session. Say for example, so we have some codes here. 97110 is for therapeutic exercises, range of motion exercises. 97112 is NMR, neuromuscular re-education. Here a patient might be suffering from a central nervous system disorder like a stroke or a paralysis or a Parkinson's disease. So where their physician is trying to gain him the kinesthetic sense or the posture or the neuromuscular stability. In that case, you would be reporting 97112. 116 is climbing a staircase or a gait training. 124 is a massage, and 97140 is a manual therapy. So there is also traction, mechanical traction that is been given, which is classified as a supervised modality. The coding of the services under the rehabilitation medicine is pretty straightforward and pretty simple. Know the activity, what are the types of activity, see if it is supervised or is it a constant attendance modality, and if it is a constant attendance, you will have to calculate, you will have to sum the total of the time that is being spent totally, and then you will have to look into this 8-minute rule table. Based on that, you will have to figure out. Okay, for example, let's see a PT is spending 25 minutes of manual therapy and ultrasound service. So which means this is going to be a constant attendance modality. Okay, 25 minutes of manual therapy and ultrasound, and he spends 5 minutes of unattended electrical stimulation. Okay, so here it says 25 minutes of MT and ultrasound. Now you will have to see where does this 25 minutes come. 25 minutes comes in this 23 to 37 minutes. That means you can report 2 units of, in total you can report 2 units. So what we are going to do, we are going to report 1 unit of manual therapy, which is 97140, and 1 unit of ultrasound, which is 97035. Plus we have this unattended e-stim. Here you should understand it is unattended study, which means it is a supervised modality. Time documentation is not needed for coding. So you can do away with this 5 minute and you can variable code the e-stim. Please beware that you are not supposed to sum the time of the supervised modality. Okay, don't take like 25 plus 5 is 30. Even though it is 30, it still comes to 2 units. But still, the correct coding would be like, you will have to sum the total timed activity, see number of units. Perhaps if the number of units is like 40 minutes, Say for example 40 minutes of MT and ultrasound spent. So 40 comes around 38 to 52 minutes, and for that you can report like 3 units. So you can very well report 97140 into times 2, 97035. Here you don't have to worry about for which thing we'll have to give more weightage. So one easy thing would be like, you see for which timed activity the physician is spending more time, then you can give for that itself. So I hope this would be very easy for you all, because you can expect a question from this part as well.